This video is going to look at addiction. Now you've got to understand the difference between addiction and dependence, and also substance misuse and abuse, and also how we use the ICD to diagnose someone with addiction or dependence syndrome. Now, a few key terms. When we're talking about addiction, we're talking about when people use a substance and that becomes their main focus, regardless of the harm they're going to cause to themselves or others. Addicts then need to use regularly in order to avoid withdrawal symptoms. So addiction is when that becomes the main focus in your life. Whereas dependence is a characteristic of addiction. This is a strong need to continue substance use because the body only works normally when that substance is present. You become dependent on it. And when that substance isn't present, again, you're going to have those withdrawal symptoms. Substance misuse is when using a substance for purposes or in amounts which are different to the way the drug is meant to be used. So you might be using higher amounts of a medicine or some form of drug than it states on the bottle. Whereas substance abuse is when a person is using a substance in a way that's harmful or dangerous for the user. Now, the characteristics of addiction. The actual medical term for addiction is dependence syndrome. And the ICD-10, that big book with all those mental health problems in there, describes this as using a substance becomes more important than other behaviors. And there's a strong and overwhelming need to take a particular substance, whether that be drugs, alcohol, whatever it is. And to diagnose it, doctors will use that ICD-10. So some of the characteristics that would be there for dependence syndrome would be a strong desire to use a harmful substance despite its harmful consequences, difficulty controlling its use, a higher priority being given to substance use than other activities, and experiencing withdrawal symptoms when substance use is reduced or stopped. Also, having an increased tolerance to the substance, requiring increasingly larger amounts for the same effects to be experienced.